Hi everyone, welcome to Demystifying Medicaid with Dr. Krish. We're so grateful that you would spend some time with us as we try to figure out this complex healthcare system. The Robert Wood Johnson Foundation did a study recently in my hometown of Minneapolis, St. Paul, and it found that people separated by just 3 miles, zip codes of 3 miles, have a 13-year life expectancy difference. We know that individuals who live in rural communities in our country live less life. We know that African Americans, Alaskan Natives, American Indians, all have lower life expectancy. Much of these differences are attributable to health disparities. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health. Despite some of these sobering statistics, we know that there are initiatives around our community that are doing great work to try to close some of those health disparities and try to make health better for our neighbors. Today on Demystifying Medicaid, we get to talk to 2 heroes who are doing incredible work in our community. They're going to share their stories of how they're tackling problems in our community and making health better. So with that, I get the privilege of introducing 2 friends. Shayanga Beecher is the Pediatric Mobile Health Medical Director at Hennepin Healthcare, and Jakara Warfield is the Community Health Coordinator of North Market. First of all, thank you so much to the both of you for being here. We're so grateful.
Thank you for having us.
Thank you. You all are doing important work out there, and for you to take a moment out of your work to share your stories, I think we'll share with folks the things that we can do to make health better. I'm going to start with you, Shayanga. And I'll say, for the record, so on my first day of work at Hennepin Healthcare, I was oriented and introduced to the place by Shayanga Beecher, and now she's moved on to much bigger things, doing incredible things for our community. But Shayanga, tell me, you are doing incredible work in mobile health. How did this start? How did you identify sort of the problem? What inspired you to get into this work?
So we started quite early in the pandemic. Remember the day, May 7th, 2020. And if you think back to May 7th, 2020 in your life, it was a very chaotic and even scary time to be alive, whether it was in Minnesota, America, or in the world. We didn't know much about the virus. We didn't know much about how we could continue to access healthcare. And so a colleague of mine, Dr. Don Martin, and I decided, what if we just bring healthcare to people? And so we got a soon-to-be retired white van, pretty unremarkable and kind of shady. We got together our partners as community paramedics, some willing nurse practitioners, and said, let's pack up the coolers with some vaccines and get to kids that are due or behind on their shots.
And so tell us just a little bit, what is this mobile initiative that you're doing? What do you all do?
So it started off as the vaccine mobile. Let's get vaccines, childhood immunizations to kids who need them, so that we're not fighting both a measles pandemic on top of the COVID-19 pandemic. Soon thereafter, we realized, you know what, it's not just about vaccines, it's about basic pediatric preventative care. As you recall, back in May of 2020, we also faced the murder of George Floyd, and it really changed the way that everybody, myself included, looks at healthcare and equitable justice for healthcare to everybody. And so what we decided was to expand the scope and provide A to Z services for kids. That includes a well child check, a health assessment, basic labs like hemoglobin and lead for screening for the toddlers, checking in to see how kids are developing, how their mental health is. And then because a lot of families that utilize our mobile health program face other barriers to care, social determinants of health as we call them, whether it's food insecurity, challenges with transportation, financial strains, we make sure that we come ready to address those social determinants of health. So for example, if an individual or family is food insecure, we come with food bags and we make sure that they're connected to food shelves in their neighborhood. We have a community health worker who is bilingual and speaks Spanish and make sure that families are connected to culturally congruent resources in their neighborhood. In addition to providing care in the mobile unit, we also provide care at community sites. And we partner with public schools, charter schools, as well as PICA Head Start centers throughout the Twin Cities Metro, so that it's easier to get to a larger group of children. So that means that we go to a school gymnasium, a parking lot, a library, and we set up shop. Our team, our services, our immunizations, and our swag.
Awesome. So this is a really different way of practicing medicine, practicing pediatrics. How has it been for you and the other providers? And then how has the reception been? What are families feeling or thinking or saying about this kind of care?
There's something unique about the experience in which you are in the neighborhood or environment of the patient. The power dynamic shifts. You're now a guest in someone else's home. And I think that concept of the doctor will now see you has shifted to the patient will now see you. And what does that mean to be available and to understand and listen and prioritize what the patient's needs are? I think for me professionally, that has been incredibly rewarding, and it has sort of brought me back to some of the reasons I wanted to go into medicine and nursing. And it reminds me that despite the chaos, the sort of business as type of what healthcare has become, the true engagement is a healthcare provider and a patient in helping that individual to become healthy.
And the patients, are they
Love
enjoying?
it.
Yeah,
Love. I mean, first it was kind of weird, right? Because we're rolling around in this sketchy white van and saying, hey, can your kid step in the back and here's some needles, right? Goes against everything that we were taught about in school.
It's true.
We have a really nice van now, thanks to Hennepin Health reinvestment funds, and it's child friendly, it's small, so we can navigate city streets. It has really fun graphics and cartoons of different characters and superhuman costumes with capes. And the unit itself is large enough that it can accommodate multiple children for our larger families, or for multiple individuals for multi-generational families.
So Shayanga, not only have we worked together in the clinical setting, but we came together to have a conversation about how could we use the Medicaid program, Hennepin Health, to expand work. Can you tell us a little bit about where you're hoping to expand this work to next?
So we actually have jumped the gun a little bit on that. And so previously we were focused on child immunization rates, broadened it to look at well-child checks or child and teen checkups. And what we noticed in engaging with families is that providing care to kids is a great way to engage with mothers. And oftentimes, and I'm speaking as a mother, I will prioritize getting my kids' teeth checked, their appointments made, their shots done, but I'm usually the last person to think about in terms of my own health.
Yes.
So wouldn't it be great if we could provide care to mom and baby at the same time? And one important time in which that is available is that postpartum, meaning 6 weeks after a mother has delivered their newborn, to provide care for both mom and baby together in the mobile unit.
Wow. So really taking from birth onwards and multi-generational patients. That's beautiful. Well, thank you so much for the work, and I'm really excited to introduce Jakara Warfield as well, because here's another example of taking what we think of as care that belongs in hospitals and clinics, but saying no, we got to democratize this care. We got to bring it out. Jakara, you work at North Market.
I do.
And North Market is a beautiful place. I've had the privilege of visiting. Can you tell us about North Market? Because it's a special place.
Well, North Market belongs to Pillsbury United Communities. It's one of the most wonderful places that I've ever been. Of course, I live in the community, and so shopping there is it's like an old-fashioned store. Everyone is friends, and everyone speaks, and it's just such a wonderful place to be. Not only is it a grocery store, but there's a cafeteria that serves soul food. There's also the community area where I work, where we rent out spaces for meetings or events. We've had quite a few different events there, a lot of seminars, meetings, and the community health space is just, to me, one of the best things that you can find in a grocery store.
Yes.
You know, it's just like kind of like, how do you find that? Where do you know, there is no model like that I know of in our community, where in one breath you get your groceries and the next breath you get your blood pressure checked, or you can rent a room for an event that you're having. And so North Market is just one of those great places. It seems like a Barley's and Lunds from time to time because of just the atmosphere, but it reminds you of one of those old mom and pop stores where everyone's so happy. It's like we get a lot of compliments on our customer service and our cashiers, and I sit in one of the offices in the back and I can hear them. Good afternoon, how are you? And it's not a customer that goes by who doesn't get that same good afternoon, how are you? And their conversation starts from there, and you can hear the other person on the other side of the cashier speaking, and sometimes since COVID has been here, and people are still lonely.
Yes.
And people want to
Yes.
talk. And so we get a lot of conversations. Sometimes the people stand there 15 minutes talking to the cashiers, and they're older people because we're located near 2 senior high rises. And so I think them are some of my best things about North Market.
So in just what I'm hearing is it's not just a market. This is a community center. This is a place of gathering and a place of community, and that's such a beautiful thing. Can you talk a little bit about why did Pillsbury United Communities, why did they decide to build North Market? What was the impetus behind that?
I believe the food desert piece. You know, North Minneapolis is a huge food desert, and the stores are far and few in between. And when you do find one, it's a little corner store that the fruit and veggies are withered up, and you know, not to be mean to anybody, but it's just what it is, and mostly junk food. And Pillsbury probably we're into the pieces of wanting to promote health and wellness and goodness for the community. We didn't have that before. Let's see, Aldi's closed. Cub Foods is not open. I'm not sure what time Cub closes, but they don't. Well, they're not even on the same level.
Yeah,
but
yeah.
I'm sorry, but I believe it was to promote healthiness into the community and bringing fresh fruits and veggies into a desert where there wasn't before.
And I will say, first impressions on when you walk into North Market, there's no withered nothing. It is beautiful.
Yeah,
It's beautiful. It is lots of colors. It's gorgeous, and it is welcoming, and all the things that you've mentioned, Jakara. Jakara, you talked about your community health space, but you've used that space. You've been proactive about it. So can you tell me about, we got to collaborate on blood pressure checking. Can you tell me a little bit about why you thought it was a good idea to walk down the pathway of checking blood pressure at the grocery store, and then how you did that? Because you implemented, you did
definitely,
it.
Definitely. You go to Hy-Vee, you go to Cub Foods, you go to any of the bigger chain grocery stores that have a pharmacy in it. You always find a blood pressure chair. And I had frequented North Market before I started working there quite often, and I'm like, well, where's their blood pressure chair? Where's this and where's that? And there wasn't one. And so when I was hired on as community health coordinator, I was in a meeting with Hennepin Health, and the conversation just kind of rolled off my tongue. It was just like, it would be so nice if we had a blood pressure chair. It was just a wish. It was just an idea, a thought. I never thought it would manifest, ever. It was just something that I was telling someone that I wished that we had. And she was like, oh my goodness, that's a great idea. And it took about a year to manifest, but I came back off of a leave, and she's like, we did it. We're getting that high blood pressure chair for you, and it'll be there shortly. And I was so excited. I was like, are you serious? And it was like tears were just joy, and it was like flowing through my throat, flowing through me. And I was like thinking, this is an awesome thing. And so when we got the box, it was in this big crazy crate. And everybody was like, what's in the crate? What's in the crate? So we had this guessing game. And it was around Valentine's Day. So I put all these hearts on it, these big red glitter hearts all around it. And I said, can you guess what's in the box? No one guessed what was in the box. I had pop machine, I had all these weird things, and I'm like, no, sandwich machine. No, it's not. It's not a candy machine. It's not a vending machine. And the big day that we revealed that we had balloons, and so it made the people that were shopping there just wanting to know. They were like, well, when are you gonna? And I was like, okay, we're gonna do it then. And we did, and people were excited that we were getting that high blood pressure chair. Not only just for me, but for the community, for the seniors that live in the building that are scared to go to the doctor, for the staff that work overtime and feel overwhelmed sometimes. They'll come in, a lot of times I'll see one of the ladies and she sits down and she checks it frequently. And every time it's high, I said, you need to go to the doctor. We need to get you scheduled. And she's kind of neglecting herself right now. And finally I got her in, and she's medicated now.
Wow.
And so it's to me, it's something that's going to save some lives in our community. But people are scared to go to the doctor. They're just terrified, so.
And one of the things we think about is, high blood pressure, you're not going to feel anything. You're not going to feel a pain in your arm. You're not going to feel a pain in your head necessarily. It's silent.
It
and
is
so
very
unless
silent.
you know about it and have some way of knowing about it.
Exactly.
You might not get the care you need, but
Right.
So it sounds like people are using the chair. Can you tell us a little bit more about your department? I mean, it's unique, it's innovative. How are you connecting folks to healthcare? How are you, when they come to your grocery store and then they say, oh, checking my blood pressure, how are you promoting health and getting them in where they need to go?
So basically what we do is someone comes in and they check their blood pressure and they'll stop in and say, hey, it was kind of high. And I tell them there's a card there. I say, keep up with it. Let's just keep up with it. The next time you come in, let's check it. And if it continues to stay high, then I think that we need to schedule a doctor's appointment. And people that don't have health insurance, generally we send them down to Fremont Clinic. Just because it's in the neighborhood and it's close, and a lot of times people are more trustworthy of their community, people that work in their community and live in there, and have something in their community. And so basically that's where we send most people, and then they kind of go, if it's something more that they need, they generally get sent by the Fremont Clinic.
Wonderful, wonderful. Well, so to both of you, you both have seen a challenge and really walked miles to try to push a solution forward. We have neighbors out there who are seeing challenges right now in their community, whether that be around food, affordability, healthcare. Do you both, as experienced trailblazers and heroes, what advice do you have for those folks as they see a problem, as they try to come up with solutions?
For me, my biggest thing is don't give up. There's always someone that's willing to help. There's always somewhere that you can go that we can, and if you need someone to go with you, in my position, I'm able to do that. And so I will walk them through it and hold hands until I can get them to be able to trust a doctor or get the understanding that they need from the doctor. And so basically, I just say don't give up. Fight the fight. It's worth living.
Shianga, any thoughts about solving complex problems?
I think I'm one to sort of challenge the status quo or the paradigms as we know it. And my question is always, well, why not? And I think whether it's healthcare activists, healthcare executives, or patients, if the answer is no, take a step back and say, why isn't it a yes? Or figure out how can we change it so it makes more sense for people. And finding the right people to sort of change the system with you.
Great advice from both of you. One thing that I think about is that both of you have worked really hard through challenging times, whether it's the pandemic. The last few years has just been really, really challenging. Can you talk a little bit I think some of my advice to people trying to innovate is take care of thyself. Because this is hard work.
Yes.
And being in community, being in solution mode all the time, this is hard work. Can you just share with me a little bit about how you both take care of yourself? Because a lot of the work that you're talking about, whether it's getting your blood pressure checked or getting that checkup while kids are doing all these things, is about taking care of themselves. How do you all take care of yourself? Maybe a loaded question. Maybe a loaded question. So.
Pedicures.
Wonderful, wonderful. Love
Movies, spending time with my kids.
it. Love it.
That's kind of the gist of for me.
Yeah, wonderful.
God bless you for asking that question, because I think that is always on my mind. Is this worth it? Like, what are we doing here? We're just pushing against the grain. It's an uphill battle. There's so many systems and so many silos, and just trying to get from point A to point B is exhausting. And so I have been asking that question to myself. And this sounds silly, but I buy myself flowers on Sunday.
Love it. I love it.
And there's a grocery store by my house. It's $5 a bouquet. I put it in there, and it's a little thing. I'm not one for like bats or, I wish I was, but I have 3 young kids, and I'm.
We'll be interrupted quickly. Yeah, fair enough.
So it's just the flowers, and then vacation. Just taking the time off to turn that phone and computer and unplug and rejuvenate, so I can go back at 110% when I get back.
Yeah. Well, I think it's clear that both of you are going at 110% for your community, and just so grateful. For the record, at the Supermanian household, it's Cinnamon Roll Sunday.
Yeah.
That's our pause on life. So we do cinnamon rolls. But in our community, there are innovators, and they see the need, and they identify a solution, and we've spent this entire podcast trying to highlight their incredible work and to demystify Medicaid. But there's more you may want to learn. To learn more, go to MinnesotaCare.org. If you found this show helpful, or you know someone who could use this episode, please check out our website, hennepinhealth.org/podcast. Share it with your friends and with folks who might need it. Everyone has a choice of how they spend their time. Thank you for choosing to spend it with us. Stay well and be well.